Yes, we can start, Mr.
There we go. All right,
Yeah.
thanks. So, good evening, everybody, and welcome to this webinar that we're organizing with India Sanitation Coalition, Center for Science and Environment, CDD Society, IRC, UNICEF, and WaterAid, and of course, the Susanna India chapter. The purpose is to help implementers take decisions about managing fecal sludge in rural areas and to help them through developing a decision tree, which implementers such as panchayats and rural municipalities can use. A thematic discussion on the same topic has been ongoing on Susanna, and maybe some of you have also seen it and responded to it. I'll just bring out a few points from the thematic discussion, and then we'll lead into the webinar because the processes are complementary here. The participants in the thematic discussion have said that how do you select the ideal treatment capacity for the designing fecal sludge management given a cluster of villages? Now, the varying scenarios across a single district and assessing ideal capacities which would cater not just to present but to future populations is a challenging task. And it's not the same as putting in a toilet for a household, but this is something that's going to be ongoing for several decades. Even if infrastructure for treatment is built and provided, ensuring proper and timely desludging and the discharge of the collected sludge at the designated point is another challenge, and it requires much stronger institutional and regulatory mechanisms. The end use of the fecal sludge and the liquid should determine the technology used and the standards prescribed. With a different economic and administrative structure as compared to urban counterparts, that is municipalities, neither the community in rural areas nor panchayats may have the sufficient resources or capacities to manage an FSM system unless it is low cost and technologically appropriate. Faulty construction of toilets, that is single pits, and containment tanks, that actually are a euphemism for septic tanks, in most parts of rural India could pose a demand risk for any new FSM system. There are limited financial resources and behavioral challenges, and it might be difficult to attract private service providers in rural hinterlands. And also the market is much more dispersed than in urban areas. One major reason for poor FSM in rural areas is its high cost. Existing FSTPs across the country, the CapEx and OpEx have not been very cost effective if you take a full cost recovery approach, and panchayats cannot afford to build or operate them. The transport of fecal sludge for treatment over long distances is also not viable because of high transport costs. Now, some solutions have been proposed in the thematic discussion. One is to develop a public-private social partnership using a hybrid annuity model. The value proposition from treated fecal sludge and water needs to be demonstrated to make the system viable for private operators. Promoting on-site sanitation strategies can reduce the problem, such as converting single pits to twin pits and making sure that the containment units have been retrofitted as septic tanks. But they have their own challenges. And it may only be it may be the only affordable method in the long term. Two existing models of FSTPs were discussed or presented in the forum during the thematic discussion. One is from Wayanad in Kerala, which TriMove infrastructure built and operated for a year. This has now been handed over to the municipality that is working out how to ensure its financial viability by increasing the tipping fee and selling the treated fecal sludge. The second FSTP is in Odisha in Dhenkanal town. The revenue is from demand-based collection. The FSTP serves the town of Dhenkanal and 49 panchayats. And it is another model that proves that the clustering approach for the FSM can work. And we will hear more details about this during the webinar. Now, I would like to introduce our eminent panelists, and they are from different parts of the country and neighboring country, Bangladesh. Dr. Abdullah Al-Muid, who is the Chief Operating Officer of CWIS-FSM Support Cell, Department of Public Health Engineering, Bangladesh. Mr. Ajit Saxena, who is the Executive Director of EEDS Bhopal and is an international development consultant. Mr. Sudanand Mohanty, who is the Associate Fellow and State Coordinator, Odisha Projects for the Center for Policy Research based in Bhubaneswar. And Mr. Avinash Y. Kumar, who is a Senior Fellow at Saki Waters in Hyderabad. So we have people from different parts of the country, different experiences, different perspectives, and it's very exciting to have them all here. Thank you for joining. We have two very experienced facilitators, Susmita Sengupta, who is the Senior Program Manager at the Center for Science and Environment in New Delhi, and Sandhya Haribal, who is also Senior Project Manager with CDD Society in Bangalore. So I think I'm going to hand over to our facilitators for a very exciting discussion. Just a bit of housekeeping to our participants. Please put your question and answers in the Q&A box, not in the chat box, and we will pick it up after the panel discussion session is over. Please do mention which speaker you have in mind when you're posing your question. Okay, thank you. Over to you, Sushmita and Sandhya.
Thank you very much, Nitya, for that brief description and also taking us through the key points of the discussion. Of course, it's been very exciting, and I'm sure many of us are looking forward to get some answers to our questions, which we've been, which have been cropping in our mind while we are working on ground. So how we are going to do this is that we have a set of questions, and we would be posing it to each of our panelists. Other than this, I'm sure the other questions that come from the participants could be taken up in the end. So as we all started with this whole subject of saying how effective are our rural schemes, how different are they from the urban sectors, from the urban spaces, because we know there's a lot of variation on ground. So before we jump into what's happening in the country, we would definitely like to hear from Bangladesh experience. So my first question would be to Dr. Abdullah, saying that what, according to you, could be the ideal approaches then when we speak of rural FSM? So, how has it been taken up in Bangladesh? If you could share your thoughts.
Thank you, Shantaji. I hope that you all can hear me.
Yes.
Right, great. So, considering the Bangladesh aspect, particularly for the rural areas, I would like to connect, first of all, the policies, how that has been implemented by the government first. So, according to our policy regimes, we have the Local Government Act and the Ministry of Local Government and Rural Cooperatives. They are the responsible actually to implement fecal sludge management, all the water supply and sanitation components, and FSM is there. And in the middle of 2017, we got the institutional and regulatory framework for fecal sludge management, which is, I believe, a very, turning point of inflection by which the country can get some direction for the fecal sludge management journey. And in that regulatory framework, we have actually made it into four, categories. And one is the rural areas, one is the urban areas, one is the the city corporations, which are the mega city corporations, and one very specific case where I live in is the Dhaka. It's a complicated city. I think this is the only city which requires very special attention. So I'm not talking about that. So that's why we keep it separate. So the rural was identified as the predominant areas to reach the SDG 6.2. And even in the last JMP report, even started from the 2015, if you go back, the open defecation was not at all a problem, even after the MDG period, because that was the journey we already had it during the MDG period. We had enough latrinization. But the thing is, when we got the SDG targets, it's the safely managed sanitation. And that safely managed sanitation contains a lot of things, the whole sanitation value chain and everything. And the rural and urban aspects need to, separate. And we have the policy regimes, that's fine. One party, the SDG achievement, according to the last JMP report 2021, it's around 42% in the rural sanitation. We have the safely managed sanitation. And the contributing factor is the twin pit toilet. I'm sure we all have the, have very good discussion today also, the challenges. And I think the problem is almost same, the construction problem here in India and Bangladesh, so far as I know. So the point is not that. The point is the contributing factors. Is the pit latrine, twin pit latrines, that actually gives the momentum for the the safely managed sanitation situation for the country like Bangladesh. But the point, another thing came when the 2018, when the present government, Awami League, came to the power again, and our honorable Prime Minister has a very, very strict and very specific political agenda, that the urban facilities need to go to the rural areas. We say it Amar Gram, Amar Shahar, in English is my village, my town. That means the facilities, that means improved facilities need to go to the rural people as well, who are at the, extreme, difficult to reach even to that. So how to reach that? That means that is a political agenda by the government, present government, and the government is willing to implement it, and the Prime Minister office actually is coordinating all the ministries required for this implementation of the very huge project. So the situation has changed. The rural aspect is now changing. And the middle income countries aspiration of the Bangladesh, which is another, pushing factor for which the whole sanitation journey is different than we anticipated even before, 5 years before. So considering all aspects, what I, the nutshell is that changing situation we are adapting, and the rural urban context, a mixed mood of, situation. It's not the absolute rural is the twin pit, absolute urban is the, all sort of safety kind, no, not that condition, but a mixed mood of, technology selection, a mixed mood of, institutional arrangement as well, and a lot of collaboration, even in one ministry, local government ministry, by the local government institutes are required, and we are that, the paving that route. And accordingly, we have developed the National Action Plan last year, the 2020 and 21 for the rural areas also. And now the time to do the action, even I'm sitting here inside the government, the Department of Public Health Engineering, which is the responsible for the sanitation journey for the whole country, especially in the rural areas, also in all the Purushabhas. So what I can say in a nutshell, the journey has just begun for the rural areas also, and also the urban areas, considering all the challenges, how to cope up that, how to anticipate that, how to overcome that. I'm stopping here now, but later on I shall come back again. Over to you, Shandhaji.
Thank you so much, sir. So that's great. You touched upon many aspects, not just limited to planning, but advocacy, about policy, about regulation, behavioral changes, which is very relevant and which is really important to ensure success of these initiatives. I will get back to you again on particular questions in other aspects of planning and implementation. But I would now take this question to Avinash. From a planner perspective, like Sir rightly pointed out, we do have guidelines, we have state level policy in some cases. We have a institutional mechanism which is building on the existing institutional mechanism. It's not that there's a separate entity doing, focusing on rural fecal sludge management as such. But then according to you, how different would these FSM frameworks be? Like, even Sir pointed out saying that urban areas, you have to, see from a different vision. But our rural areas would be facing very typical problems, whether it's related to geoclimatic conditions, it's related to their, sparsity of development, or it's just the water scarcity, which is really a critical issue in some areas. So what, according to you, would be, a difference in these kind of FSM frameworks when we are speaking of specifically rural context? Yes, Avinash.
Yeah, hi Sandhya. Nice to connect after long. And also, firstly, good afternoon to everybody. So yeah, s- starting off my answer to this question. So see, this part of this question, a part of the response to this question is kind of broad. We need to be clear that whether it's urban or rural, our goal is that the sludge that is emerging from these households, we are trying to, do pathogen reduction, organic load reduction, and finally reuse, right? That's same whether it's urban or rural. The thing that is different is obviously the physiographic setting, the settlement typology, the when I say settlement typology, I mean like the morphology, like how the roads are put in place, and also the in settlement typology, I would also consider the income groups of the people, and finally the kind of assets that we are talking about, the kind of user interface, right? At the user interface, you have toilets, which largely will be of a certain kind in the rural setting. So it's now when this is different in both. Now, what do we know about this difference? So based on my own, the baseline assessments that I've done in multiple cities and multiple villages, I've done in fewer villages because the nature of how those projects get commissioned also is quite different. Like you said at the very beginning that, FSM planning is largely, there's a certain similarity. Though there is a similarity in the methodology, however, when you see how the work gets commissioned and the knowledge gets shared, it's very different universes, rural and urban. So let me just tell you what I can see when I compare the data set. So in one thing is that the urban areas, for example, you'll find a lot of these let's look at one or two of these variables, like when at the settlement level, what kind of toilets we are finding. So in the urban settings, you'll always find a lot of holding tanks and septic tanks, right, with a lot of liquid content and all that. Whereas when you go to the rural areas, you will right now, because of the Swachh Bharat mission, you have a lot of tanks and all. However, there is a the issue is that the way these tanks have been built also, right? They, like, if you were to go to a rural area, you will find that fecal sludge per se is not their specific problem in the rural setting. The real problem there is the other component of wastewater that is emerging there. Fecal sludge itself, when you talk about in the rural setting, it's a question of scale, getting as many villages together. And these also this problem manifests in different formats. Like you will find rural areas which are on the outskirts of an urban area, right? So there will be a lot of urban character there. There'll be a lot of people with a lot of higher income, and because of that, they could afford larger holding tanks and septic tanks, so the liquid content is much higher. You might find so this is a specific case study in Palamner and Gangavaram, in Chittoor district, where when we did some surveys, we found there is a large number of pits still, they're prevailing in the regions. And when you do fecal sludge management, as a planner or a techie who is trying to create a solution, you will immediately jump to what is the technology, where to put the treatment plant. But the actual problem is at the user interface itself. The problems are generally about leakages from these tanks. The outlet of the tank is generally opening into the stormwater drains. So uh, it's an addition to the grey water management problem that they already have. And when, as a consultant, you enter these regions, you can't look at the fecal sludge management grey water separately. Like there was a particular training that we did with the Center for Science and Environment, where we went to one of these cities in Rajasthan, and we realized that everybody is actually complaining about their large amount of grey water that's just coming into the open, and also the outlet of the tanks which are let out into the open. But where it is enclosed, the problem is something which cannot be diagnosed, right? Because the problem is, okay, if you have a unpaved, if you have a tank which is unpaved at the bottom, then you are a little worried, is this in a high groundwater table zone? And if it is a pit, you anyway have to convert the pit because that's what the guideline says. So there is this particular issue in FSM in the rural setting, which will influence your FSM framework, which is at the user interface, what is the type of toilet and what is the risk, you know, that is associated to leakages. And also the gray water thing will always emerge, because when you start talking to the officials in the rural area, they would want a complete solution. They wouldn't you know, just say, yeah sir, we got the toilets, we know what needs to be done there, but what about this also? So it's a, and the, if I have to just summarize this for now, I would like to really put it out that, see, the moment this, we have a lot of stakeholders entering this, which is what is the case right now for rural FSM, we should realize that there are some parts of the decision making that are quite democratic, like the way you do baseline assessment and all. Now there are a lot of players who come in and give good information, but when you get into tech selection, right, technology selection, this becomes extremely driven by a lot of you know, narrow agendas. So it's kind of important to be a little careful in that stage of decision making. Whereas the earlier decision making, which is the baseline assessment, type of toilet, what kind of systems are there and all that, I believe we have a you know, tried and tested, you know, set of methodologies which will not fail. So the problem right now, even the scalability of rural FSM, I don't think is a genuine problem, because I know that there are a lot of, you know, thinkers in this space who know the solution. Because at the end of the day, like I said, the broad objective is pathogen reduction, load reduction, and finally reuse. And you want the right scale to do this. So I'll rest it at that for now, that this is what should, you know, drive the methodology, and that will be driven in different physiographic settings and different regional settings slightly differently.
Thank you, Avinash. So yeah, very rightly pointed out, it's not as simple as we say we want to make a decision tree and it's just formed by a few people sitting together and putting their minds. So of course, there are a lot of interlinkages, a lot of dynamics of not just other forms of waste, but also, as you rightly pointed, there's a social, there's a political, financial, all kinds of issues which, you know, sort of play a key role in decision making. So Dr. Abdullah, I would again get back to you on this, saying that since we are talking of a decision-making tree, because we feel this could be one starting point to planning any initiative on ground, right? Because if you're planning as an expert, as a subject specialist, you would see things differently from the way Avinash rightly pointed out, saying that how will a panchayat development official or just a resident of a gram panchayat would see it, right? So what is important for them? Are their inputs being taken into this kind of a decision-making tree? And how do you really go about with this process? If maybe you could share some thoughts around decision-making specifically from Bangladesh perspective, that would be great.
Great. I mean, thank you, Chandraji, for the very good question. I mean, first of all, for the decision making, I mean, the decision makers, let's, you know, think about how to achieve our target and how to convince the decision maker. That's the point we need to discuss. We need to understand that. So, but because the decision makers usually, they are the political people and they are elected people, of course, and they are the representatives of the mass people, whether it is a union parishad or gram panchayat in your case, or in my case, maybe Purushabha, maybe. I mean, the point is how to let them in a part of the whole discussion. So I could remember before starting this webinar, my old friend Nitya was saying or mentioning about the SFD, sheet flow diagram, or some sort of tool, CSDA tool. I mean, these are the things where to start from, how to, you know, we should not go around the lasso. Someone has to cut the lasso and start and identify the starting point so that it will be a line, straight line, not the lasso, the circular one. Cut it and make it a straight line and start it. And it may be the sheet flow diagram. it may be the CSDA tool, whichever is attractive. There is a huge space for the scatter flow diagram or sheet flow diagram, which is now in the Suzana. And I think the way that India and Bangladesh are moving, we need to do the advocacy from inside the government. I would like to highlight this point. I mean, before that, I was also have the working experience in water aid, and I prepared also many sheet flow diagrams from Bangladesh. But from when I did it from the government side, now when I'm doing, and you will see plenty of sheet flow diagrams in the Suzana website from Bangladesh. The point is, it is an easier tool to let the government endorse or acknowledge that where we are. And also the elected member, they can understand the green and red. And luckily we have the flag of green and red. So it is very easier for Bangladesh to let them understand. And we all want is the green. We all want, that is our target. So it is easier. Where we can start, I could, put this example here that we have started with the sheet flow diagram. Also, the CSDA tool, also for the, for the Purushabha people. But the difficulties point is the development of the capacity of the people, of the Purushabha people or your Gram Panchayat people. They mostly want to see the result. I need this 500,000 toilets for this village or this Purushabha. This is their result. They are not bothered about that green and red zone. But once it is very easier to understand, and we can start from there, things are going very easily. There is no need of any discussion whether this is the SDG target 6.2, whether this is the actual GMP data. I know that that was the discussion of the sheet flow diagram. Don't do it. Leave them. Forget about this. Just start the discussion with the sheet flow diagram with your Gram Panchayat or Purushabha people. Things will be moving in a much easier way. I can say that from my experience also. Over to you, Shantaji.
Thank you. Thank you so much, sir. So that's interesting that you're mentioning about the sheet flow diagram, which has been used widely in the urban space. Of course, in the rural space, if you look at our guidelines, it mostly gives a very simple flow chart saying that, at the first point, try to take care of, manage the fecal sludge within the premises by doing twin pits. If it's not possible, then go on to the next nearest available treatment plant. And for this, we are tagging to the urban sewage treatment plants, which because most of us working in the sector, most of us in the country know that they are not operating to their full capacity. So we, of course, do agree that there is some residual capacity for treatment, which could be used for managing fecal sludge as well. So that the idea was to see how do we really go about decision making, and not just, as you rightly mentioned, the decision makers, but also to bring in the informal sector players into this. So maybe showing them pictorially could sort of help them in rightly deciding their priorities. But speaking of the urban STPs, I would next like to go to Mr. Hridayanand Mohanty. And based on your experience from Odisha, which has been a front runner with fecal sludge management in the country, we would like to understand how is this urban-rural convergence really working on ground? Because it's a novel idea. When we speak of it, there's a lot of logic in it. But end of the day, the success totally depends on two people. That is one on the rural side and the other on the urban side. So are there any such experiences or key pointers that you could share, which could be useful for the other states? And maybe Sir, even from Bangladesh, later on, we would like to also understand this. So Mr. Mohanty, please. You're on mute, sir.
Yeah. Let me now say thank you very much for choosing the panelists. Beginning with this, the questions what you asked me, that the experience we do have on the ground, particularly Odisha specifically, as you all know that you have also rightly said that Odisha is emerged as a kind of not only a pioneer but also a leading state so far the urban FSM is concerned in the country. But so far this urban rural experience is concerned, this is not that the new thing happening now. This is already there because the urban people, urban FSTP, urban FSM services is being delivered in the rural areas, particularly in the fringe, in the nearest, rural people, particularly those are located nearest to the FSTPs. So that is there, but then that has been done in informally, because whenever there is a kind of demand, the urban local body receives. Accordingly, they can just serve the people. But there is no such kind of a formalized way of or a systematic way of delivering this service to the people. Those are settled around the urban facilities, or particularly the efficient facilities. So keeping that view, we had earlier experience when we started working in urban space, knowing the very fact that this is the kind of service which is very much required in the urban space, particularly where the dynamic is totally different compared to the rural people. We feel that yes, this service is definitely required and this service should be provided to urban people. But the moment it is completed and the urban local body try to serve the urban people, they also have some demand they receive from the continuation of rural people. Then they decided they'll have to extend the services. So this is the background based on which we started, extending the services from rural part to the, from urban part to rural people. And that was discussed through a kind of project, pilot project, happened in case of Dinkana, which has been also a pilot city for urban FSM as well. So there we do have experience of private operator initially, but subsequently it was decided that how these urban services can be extended to rural people, so that the people, those are settled around these FSM facilities, they can also get benefited and they can safely manage the sludge they generate at their end. So keeping that view, we discussed with the district administration and with the support of UNICEF. We said that we need to at least see that now there is no such facilities available in rural areas. They will be definitely depend upon these urban people, urban FSM to get these services. But in this structure, in this background, when we discussed this the district administrations, they said yes, this is a kind of a gap which we feel now, because now the 100% people are now access to the toilets, but there is no such facilities currently available to these people. So we'll definitely extend this pilot project to them and see how it is working. So that is the background in which we started kind of things. And then we started seeing that how we can make progress. I mean, how we can proceed accordingly, so that these people, they can get these services, not the way they are getting earlier, but the way it can be systematically delivered to them, and that will be formalized. So knowing the very fact that this service is not available at their level, how they can get the formal services from the urban local bodies, that was the process, that was the beginning point for us who started working at the district level. And we started working not on district level, but at the same time also started working with both urban local bodies as well as the rural local bodies, particularly Gram Panchayat. Because here the Gram Panchayat where people will be getting the services, not the district, but the district will definitely take the decisions and kind of give a kind of direction to the rural local bodies, saying that yes, here is the existence of the services and facility available. We can at least connect to these people and link yourself to these people and provide the service to the people. But that is the way we started this work at the urban local body level, and bring these two local bodies together to discuss how they can at least proceed on this particular survey delivery. So that is that becomes a kind of a beginning point from our end, and that what are the kind of process to be followed, because it's not so easy when we can say that they can formalize these delivery services in rural areas, but there are certain processes one has to follow to ensure that these services are available to rural people on the ground. So for this, we said that once we discuss threadbare, both involving both the stakeholders together in the presence of district administration or officials, then would come to a kind of a conclusion that what should be the kind of process, how they can link together, how they formalize it together, by signing a kind of agreement among themselves, what should be the kind of capacity building required, IC activity required, monitoring framework required, and all these things taken together, we decided that we should come up with kind of a complete package on which best ways we can extend the services. So that's the beginning point on which we started our journey from the urban to rural, and that is now going on very well in case of Denkanal, where rural people almost initial 10 kilometer radius, they selected a cluster, identified a cluster, then 17 GPs they got the services. Subsequently, it was extended to now 49 GPs, as Nitya was earlier mentioning these things. So these people are getting the services from the urban local bodies, and they are regularly getting the services from the urban local bodies. So at this point of time, I can keep myself here. I can proceed further once I get the questions from your end. Thank you.
Sure. Thank you. Thank you, Mr. Mohanty. So yeah, as you rightly pointed, maybe at the district level is where we need to really push the case. And in Karnataka also, it has been tried starting from the state level, but putting in a kind of a joint committee mechanism in the district level where both the urban and rural people are a part of the committee to streamline these services. So great discussion going here on the planning aspects, but now I'd like to take a pause and hand it over to Sushmita to ask questions more on the institutional aspects, because some questions are propping up based on institutional aspects here. Over to you.
Thank you, Sandhya. So we start with the questions which are more linked to the fields, so field experiences. And as I discussed earlier also, so CSE has been traveling to different states to understand what is the state of the fecal sludge in rural areas, whether it's managed safely or not. And in this connection, we have also traveled to Orissa to visit Balasore and Dhenkanal. And Mr. Mohanty has already described about the Dhenkanal. So we have also visited the Balasore one, and which is like the differences, it is just made on the land of the Gram Panchayat. That's the only difference which we have with Dhenkanal. And but the model, as Mr. Mohanty said, is also working very well. And not only that, we moved to Chhattisgarh, where we got some good examples from Durg. So although Dhenkanal was the forerunner, but we have some examples cropping up actually. And we have this Kumari FSTP, which is also based on urban-rural convergence. And Mr. Mohanty actually very clearly said why they have started with a urban-rural convergence. So if there are 63 urban FSTPs in Orissa and you are actually planning for more. So when I was actually interacting with Mr. Parmeshwaran, and I understood that they are actually thinking of more of urban-rural convergence. So as Mr. Mohanty has actually described why they have gone for urban-rural convergence and what were the bases and what was done and what they are planning. So I would like quickly move to the next question, which actually says about the clustering. So what is the basis of clustering? So as we understand, there are two sorts of clustering. One is the urban-rural convergence, where you actually cluster the Gram Panchayats with a facility of urban treatment, or you actually, what Karnataka is also doing is actually clustering the Gram Panchayats and having a fecal sludge treatment plant for the set of Gram Panchayats. So I'm moving towards clustering because Mr. Mohanty has given a very detailed discussion of why did they start with fecal sludge treatment plants and urban-rural convergence. So very quickly, Avinash, I just wanted to know from your field experience, what can be the basis of clustering if we say that we are actually talking of fecal sludge treatment plant only catering the Gram Panchayats, if we are actually starting with that. So can you actually give me two examples so that we all are clear, like, is it different, a clustering for urban-rural convergence or a clustering only for the Gram Panchayats? If you can talk from your field experience.
Yeah, so there was a scoping assessment that we actually did. So this was in partnership with WaterAid here in India. This was the example I was trying to quote earlier in Chittoor district. So it's basically Palamner is the municipality. In the outskirts of Palamner, there were 10 Gram Panchayats, following in Gangavaram and another in a mandal which was also named after Palamner. So roughly 10, 20 Gram Panchayats. Now I'll have to share the anecdote, then it'll kind of self-explain what the situation yields. So when we went there, we clearly saw Palamner already had a large, solid waste composting facility with a lot of land. And it was obvious to us that, okay, this is a clear case of, this is like roughly 8 to 10 kilometers away from both the mandals. So why would we build something again for the Gram Panchayats? Now, the interesting situation was that in both, while the first 2 days of the surveys yielded this understanding, on the third day, while we were going through each Gram Panchayat one by one, we realized that there were compost sheds in each of these Gram Panchayats. And we could directly do, because you're just getting sludge from these small household units, you can just they have a very strong incentive to co-compost it there itself and reuse it also there. And some examples, I mean, my own experience when I was back in CDD showed that over time how farmers start liking the quality of the compost that is generated from fecal sludge. So there was a clear incentive there. It was not a marketable case. I mean, it's not that you're going to generate a lot of revenue or something, but it is at least environmentally sustainable, and also you don't have to invest a lot of additional funds there. So case one would be a case where each Gram Panchayat has its own compost shed, and you can do it in a very super decentralized manner. And because the Gram Panchayats we are talking about populations in the range of 5 to 15,000, right? So it's not very difficult for them to get connected to their asset. This is kind of little important in these things. And whereas when you need to consider the need for centralizing this, when I'm saying centralizing, I mean taking all the sludge from these 20 Gram Panchayats to the municipality, on the peri-urban limits of which on the rural fringe of which these rural areas are, then the cost for collection conveyance is also to be considered. And also when you take conveyance measures, you would realize that who's going to take ownership of these conveyance measures? Like so is the institutional entity the government who is going to buy these trucks, or are these government going to depend on informal operators who've been surviving here since decades, or so many years? So the question is how decentralized at the Gram Panchayat level you want to handle it, or if you really have to get it all the way to the urban area, it's a function of the distance, because the distance is where all your carbon footprint gets created, the financial sustainability of the collection conveyance operator, right, the truck operator, comes into question. And over there, one small point is that there are some cases where the truck operator, you will consider the the operator as in-house, where the government owns the truck, or sometimes it will be these private trucks who are already there, who they will take into business, or sometimes it will be giving it you'll have some kind of a shared ownership between the agency that runs the plant and gets the truck, so that you have a incoming amount of sludge coming in. So the operational models will be around these kind of you have to take these into consideration, basically, is what I'm trying to say.
So with this, I move to Sandhya. Sandhya, as you know, that there are 5 operational FSTPs, and this data is from the ministry itself. So one means Karnataka is one of them where the operational FSTP is there. So I just want to know from your perspective, because you have been involved in all this making of this FSTP success. So what were the points you were thinking before actually clustering this Gram Panchayats? Was it only distance or something else?
So distance was the first point of concern, because if logistically it doesn't work for any operator, vehicle operator, whether it is government owned or private, why would they travel so long to discharge sludge? So how we went about in the rural part is that, now before that, I would just quickly also like to add that in Devanhalli also, which is an urban local body, we get a lot of maybe almost 30-40% of the sludge coming in from the nearby villages. Because what is happening is that when you tie up the private operators, they are not limited to urban or a rural area. For them, the only concern is that they need to provide services, get their fees against it, and run their livelihood. So in that sense, a lot of urban FSTPs are also getting rural fecal sludge. Within that 10 to 15 kilometers radius, we are fixing a number to it, because we've seen that beyond that distance, it just doesn't make economic sense to drive for so long. Second thing, what worked in our favor in Karnataka was that when we started off with the rural FSM, the solid waste projects had been implemented. They were way ahead of in terms of time, in terms of implementation status. So what we found is that there were many Gram Panchayats which had demarcated like 7 to 8 acres of land, though the requirement would have been like 2 or 2.5 acres. but then they had enough land available, which they call kharab land, where you can't do agriculture. So those were not demarcated for SLWM facilities, that is solid and liquid waste management facilities. So the idea of citing the FSTPs in these facilities was that in terms of operations, we can use the same team which is operating the solid waste facilities to operate these FSTPs also, because they are very simple nature-based treatment systems. So that optimizes your operating expenditure, your operating team, managing a smaller team to do two works at one time. And as Avinash rightly pointed out, that there is an incentive for getting a good quality manure, especially where you get a lot of vegetable and market waste. You can compost that kind of organic waste with the fecal sludge, and the farmers will benefit end of the day. So these were a few pointers that we really considered while clustering the Gram Panchayats. And also in terms of administrative units, we wanted to ensure that they are in a single district so that management institutionally also is smoother and streamlined. Thank you.
Thanks, Sandhya. So quickly, I'll just move on to we have, this time is also a constraint for us because so much things to discuss in this 1.5 hour sessions. And just quickly, Mr. Mohanty, I just want to understand from you, is this model replicable? Do you think this model of urban-rural convergence, which is happening in your Dhenkanal, Balasore, and we have also seen in Durg district, which is happening, and informally, as Sandhya said, that lots of fecal sludge is coming also from the rural areas. So quickly, one point why you think that this model is replicable, or what is your view on that?
Yeah, let me tell you, I mean, after this Dhenkanal Baleswar, now the state government is going to replicate or scale it up the entire state. So that means all the 30 districts will be now covered under this urban rural convergence, and we are now taking it off as a kind of a model in Ganjam district to start with. But then 7 districts now identified by the state government as a pilot district. But currently we are putting our focus in Ganjam as a sub-pilot district, because there are certain things happening in case of rural areas, because it is not only that FSM only, we are also looking at the PWM waste management as well. So there are certain things happening in rural areas in Ganjam. So that's why we are now focusing in Ganjam as a first sub-pilot district to look at this, how this convergence can be replicated in the entire state as a whole, and what the kind of a policy documents, guidelines, everything can be done at the state level so that that can be replicated or scaled up the entire state. So coming back to your saying that whether it will be replicable or not, absolutely, because it's very easy way to replicate in the sense, because I can add one point to what Sandhya said, mentioned earlier, the distance factor. We also look at the capacity of the plant, right? So when we go for clustering without analyzing the capacity of the plant, knowing the very fact that how much capacity is required to accommodate the requirement of rural people, if you cannot just decide upon that, if you looked into that, then it will be very difficult to extend this clustering, because you don't know how far you can stretch upon the urban services to deliver the services, so that you can at least optimally utilize the facilities available to the urban communities. So in that sense, the analyzing the capacity of the plant as well as of course the fleets available to the municipality, one has to look at it, and of course the operational cost, what is mentioned rightly. So all these pointers needs to be looked into while extending the services or clustering the entire Gram Panchayats to receive the services from the urban local bodies. But in terms of extending the services to other state, or replicating the same in other state, I believe it is quite easy way to do the things, because knowing the very fact that the facilities are available, instead of going for creating separate facilities, which will be definitely will be very difficult for managing in scale. So in that case, if we see that urban facilities, those are available to the people, those are very much located near to that one, so that they can easily go for accessing the services without asking for a separate facilities or infrastructure, whatever it is. So in that sense, it will be definitely replicable in the sense. But those people, those are staying beyond a particular limit and far away from the urban facilities, for them, this can be actually also go for a kind of a green, the way we say that is a Pagani approach and greenfield approach. Greenfield approach, we can see that is there are certain blocks in the the state where you do not have an urban facility available, but these people, they need to have at least this kind of facility available to them so that they can safely manage their vehicle flows. So in that sense, we look at the clustering for greenfield area where we can have a very integrated facilities which can serve the people within this, because that will be kind of rural convergence. Instead of we can say that urban convergence, we can have rural convergence because we can connect GP to GP, Gram Panchayat to Gram Panchayat, where we can find out a kind of central location where we can actually install these facilities and keep a particular panchayat, or even in case of a block administration, to take care of and provide the services to the people those are located in far away from the urban facilities. So this is the way we look at it, and I believe this is really applicable in other states as well. Thank you.
Okay, Mr. Mohanty. So, Dr. Almuid, I just can't stop myself asking you that whether this model will be like applicable in your Poroshava, so that to understand what Bangladesh is thinking. Means I just wanted to get a comment from you also.
Yeah, absolutely. I mean, that this is not the approach only. This is the reality. The urban and rural convergence is the reality of the country. When I mentioned that the urban facilities, improved facilities, will extend to the rural people, it means it's not only the water sanitation component, it's the whole infrastructural facilities, roads, networks, bridges, culverts, and everything. And that will incrementally, enhance that, all sort of facilities, as well as the waste also, including the fecal sludge also. So the point is, the convergence is reality in the coming days in Bangladesh. Again, I mean, the point how to address that. So in the rural areas where there are, people, extreme poor people, so how to give them the suitable toilet. So according to our proposed strategy, which was published in the last year, so the government will provide all the, improved toilet without any single penny. That means that absolutely free of cost, they will gonna get it, that one toilet, and that will contribute to the safely managed sanitation in the long run. So we will connect this unserved people. Number two, when rural transformation is going on, we are anticipating that the economical situation of the country is booming, and facilities are going. So the point is that when the rich people will get the improved toilet by themselves, like if they get septic tank and improved facilities, they will need the urban connection, the vacuum truck service to get the treatment plant. So we need to connect those facilities for the rural areas also. Number three is when the rural are changing, the growth center, the market areas, the hospitals, other facilities by the government and the private sectors, those are also enhancing the service to the people. The banks are going to the extreme areas, rural areas of the country as well. So their infrastructure grows, as well as the, the facilities of the urban fecal sludge management will be growing up. So we need to connect those areas also. Those are not the fringe areas, for which the convergence, that means rural and urban. So who will operate that? The Poroshava, nearby Poroshava will operate that, but they will extend the facilities to the rural people when it is necessary. That means when the septic tanks are needed, are there collecting the fecal sludge and coming to the treatment plant. So this is the point how we are going to address this. But one thing I would like at the end, that the government, we are a very small country, as you all know. So we don't have enough land, very honestly. So our approach is the integrated waste management, where we consider both fecal sludge and solid waste together in one treatment plant. So this is our approach. I don't think so there is better way to deal particularly in a country like Bangladesh, because solid waste is a growing problem. It will be a huge problem in the coming days, not only in the big cities, but also in the rural areas. So to address that, we are considering the same treatment unit for both fecal sludge and solid waste. Over to you, Shushmita.
Great, Dr. Almuid. So I just checking the question answer box, I just find one question from Mr. Shiv Kumar, who says that, fecal sludge treatment plants may be created, but they are actually lying unutilized. So do you face this type of problem in Bangladesh also?
Unutilized. It is question to me, Shushmita?
Yeah, it's for you.
Okay, okay. So the point, it's not the fecal sludge treatment plant, it's the operation of the fecal sludge treatment plant. It's always everywhere. So the point when we say it is my, still I am doing the advocacy inside the government, that whether we are seeing it in the lens of service or in the lens of business. So there are two different approaches. When we say that we are approaching towards the lens of service, it's the environmental benefit and all the public health benefit that will come forward first. But when we say that it is for the business oriented, it has to be absolutely business oriented, then it is different. But gradually, in incremental time, that will be some sustainable one, and for which it's not that from the very beginning of the FSTPs we are going to get some profit, but over the 10 years, 15 years, I don't know, about 5 years, the business plan is important. Previously we had the lack of that, but at present I could see the question from the Shiv Kumar also. It's not the wastage of money, my friend. It's the investment to preserve the public health of the people of Bangladesh, because those treatment plans, once we get the proper business plan, what we are now developing, and some of them are operated fantastic. I could say that Shakipur, Soyodpur, you could visit there, they're fantastic, they're operating. And the Lakhipur also running by the government, that is a good example for the ONM also. So taking those lessons and good examples and to replicate in the in the practical field, so that will be the root of how we can make it as a good investment, not the wastage of fund. Over to you, Shushmita.
Thanks, Dr. Almuid. So we have in this session, we just actually talked about the real field experiences and what are the issues and the solutions also. So, but technically, we need to also to understand what works well. For this, I hand over the session to Sadhya.
Thanks, Sushmita. So yes, totally agree that if technically also we are not in the right, we don't take the right decision, the whole efforts of planning, institutions, finance will definitely disrupt. So in terms of technical also, when we are looking at technology options, we are trying to see it over the sanitation value chain, starting right from the toilets, saying what are the toilets really connected to. So I would like to bring in Mr. Ajit Saxena into this discussion right now, saying that guidelines speak of retrofitting single pits, because we know that in many states, many districts, instead of twin pits, because of multiple reasons, there are single pits, which are really leading to a lot of these issues, and where we have really felt the need for FSM to come into play. Otherwise, with twin pits, it would have really functioned very smoothly. So what is your assessment of this retrofitment of containments as a first step, especially given in our context, the large numbers that we are looking at?
Actually, thank you, first of all, Nitya, Susanna, and Sandhya, and all the eminent speakers for giving me this opportunity. I feel that single pit is not the solution. Retrofitting means adding definitely one extra pit, and that is required also. In case of this containment, we have 3-4 options other than this double pit, like dry or flush toilet with on-site disposal, on-site system with FSM and off-site treatment, biogas-based toilets, and then BMGF reinvented toilets. If you see 10, 12 design they have developed, but 1 or 2 may be considered in future. Other than this, DRDO bio toilet is also there. But retrofitting is an issue even in the new septic tanks also. I just give an example of I was working as a team leader of ADB in Mizoram, doing the same kind of work for urban and convergence with the rural. So I find that it's a major and critical for FSM planning. We need to have technical IEC. Technical IEC means if you are constructing a septic tank, what would be the real design, actual design, and what you are doing. Normally in India, if you are a big man having more land, you are constructing big tank, and if you are a small man, you are going on different options. This was the even trained in Mizoram also. So we do have to need a plan from the beginning. Technical IEC will be involved from the beginning why a particular design of septic tank is needed. If not, what happened? In fact, 50 to 60% of the septic tanks are crying. Similarly, in 2-pit latrines, they are good. People are started using, but how to evacuate and how to treat them, like initially one of the panelists asked this question, what are the solutions? So retrofitting is a major and critical item for FSM planning. One has to analyze house-wise requirements and what is the situation, and then what would be the cost. This can be, the cost can be, the estimate can be prepared by the panchayat, but cost will be beared by the community. This is one thing. While we go for the retrofitting, even a person, medium level person, not even poor, they are not able to pay extra money for retrofitting of the septic tanks. Then the time taken for that, then the machines availability, then people are not very much convinced why we are doing. If we are not doing, what will happen? So these are the issues over there. Similarly, in the another side of treatment side, it's a limiting factor for FSM design, we feel. There are many technologies, but not all the technologies are not yet very much established. CDD has done a very good work. CSE has analyzed many things. But if you see, we, as a technical person, I don't feel that we can just suggest a technology based on few findings. So it's a very much localized level analysis, and based on analysis, we have to give these solutions. Convergence is one of the approach which is good, because if in 10 or 15 kilometers, we have the different kind of technical, different kinds of containment or fecal sludge flow, then we can take those sludge to this city-based or semi-urban based treatment plant and get it done. But another thing, again, the disposal from these plants are not very much monitorized, or data analysis is not much available. Frequency of checking is very, very less. So we can't say that things are treated well. You have to mix with the organic, other organic material and get the things good. But even the oldest experiment in Tamil Nadu, we don't have much data on this. When frequently analysis is not available. So I mean to say, we have to develop a matrix of technology. With this matrix, there is a technical IEC, why this technology is required, what are the limitations, and what are the strengths. And if you then draw a plan with community that, see, this is the place, this is the technology, but we have this much limitation in this. Then the second technology is very good, but we don't have this much money. Likewise, with the panchayat members, key players, and then community, if we do, then this technological solutions will be there. There are few technology which is invented in BMGF, and they are also saying, I think Dr. Abdullah may know more about this, omniprocessor and kind of things. But approach is different for those technology. They focused on energy generation first, and then treatment. So we are almost, that technologies are again under action research, and this needs the time. So this is what I feel. And over to you, sir.
Great. Thank you, sir. You actually extended the question, but I'm glad because you touched upon very important aspects, saying technology is not as simple as design one thing and, cookie cutter job,
Yes.
do it everywhere. I totally agree with you. And this is music to ears, saying that it is very contextual. So since I would also like to bring in Sushmita and share some experiences regarding especially retrofitment, because we also saw very unique cases where there were multiple pits, but then they were connected to each other. I mean, it was as simple as just reorganizing the connection and educating the people, the user, on how to use it as a twin pit. But there were also extreme cases where there's no space, you just had to put a single pit, or you had to put a small holding tank, but then it's overflowing into your nearby stormwater drain. So very context-specific issues we have seen. Maybe quickly, if you could share some ideas.
Yeah. So this actually again brings us back to our field experience, where we have traveled to Orissa, Rajasthan, and Jharkhand, where we find like different types of single pits. Actually, most of the cases we are finding single pits. In Rajasthan, especially, we find deep single pits actually touching the groundwater also. That's a problem. And then we have seen in Orissa also, we have seen, especially in Puri district, which is the coastal belt area, where people are not going for pits, but they are going for some type of boxes, which we call the holding tanks, and which is as big as a room actually. And so below their house, they actually construct it, and that's actually madness, which people are actually following. And even if we see single pits, like the whole sludge inside it becomes so solid and so hard that the whole thing is collapsing. So this is what we are seeing. Like, we have also traveled to Karnataka, and most of the places we have seen that single pit is the thing. Although the government has promoted this twin pit honeycomb structure, even if the twin pits are there, we rarely found that people have followed those designs of twin pit structures. So, but again, we have seen that people are not buying in retrofitting. Once is the lack of fund, lack of land. They said that, so we have actually spent 12,000 rupees for making a single pit. So where do we find the money? It's only 4,000 rupees that you are getting for your retrofitting. So this is the type of answers we get when we interact with the communities. So so the only way out we are thinking of is now that all the toilets are made in the first phase, so off-site treatment. That's the only avenue actually to bring about the safe management of fecal sludge. So over to you.
Thank you. Yeah, thank you, Sushmita. So I'll quickly bring in Dr. Almuid to give some perspectives on how you all are going about with selecting the technology, or, you spoke about twin pits, but a very quick input on that.
Yeah, I mean, thanks, Ajitji, I mean, for bringing the metrics of the technologies. I agree with you, sir. And definitely, I mean, this is the need of the people. Also, I mean, not only for Bangladesh, but also all the South Asian countries need that, surely. But the point is, I mean, that technology selection, to me, I found that it's relatively, not so much a difficulty from my field experience. Probably it's a little bit of twisting effect, what you have discussed. But let me share, I mean, some of the experiences at the hill tract regions. I mean, they are the tribal peoples live there, and they have their own, behavior on that, how to defecate and the toilet technologies. But the issue is, it's not the technology, it's the how to fit the containment to make the environment safe. That's all. We don't need to change everything. When you say reinvented toilet, multi-unit reinvented toilet, I mean, those sort of very on-site technologies, then question comes the affordability. Is the great innovation by the Bill and Melinda Gates Foundation, availability and affordability that comes to the question. And still the Ankur is doing the research in India for these technologies, also for the omniprocessor, which is a different level of treatment unit. But the whole point of discussion, please come at the user end. That's my humble submission to all of you. If it is single pit or twin pit, but let's talk about how to educate them, how to use them, how to do the O&M of their own households. I mean, even how to educate the local, masons to construct the twin pit latrines or the single pit latrines, doesn't matter at all. Make it a good one, make it a best fitted one. I mean, those sort of skills at the very grassroots level is imminent, what we are discussing here. So educating the skilled laborers as well as to the household levels, the people, are very much important. At the community scale, I think, as per my experience, it is running quite well, because in the community, community toilets are managed by, some group of people. So someone is looking after that. This is not happening well. We need to dislodge it, or we need to make it safe disposal. But, the issue comes at the household level, what my understanding is. So I would like to give emphasis on the education here. Number one, it's not only the awareness raising, not only the campaign issue, but also the education, whole education. That's why from the, our end, what we have suggested, I already mentioned that we will gonna provide the household twin pit septic twin pit toilet to the extreme poor people. But we are also developing the manual, and with their own language, actually, very local level language in Bangla, and also deliver how to do the O&M also. This is the one findings I believe that is very important. It's a part and parcel of the whole project also. It's not the isolated component. So the government is doing that component. Second part I would like to mention is the treatment technologies. I mean, there are plenty of treatment technologies, as Adit ji also mentioned, that omniprocessors and others. But to me, actually, it is something, I'm also an engineer, but it is something we discussed a lot. We focused on only the treatment technologies, forgetting about the other associated peoples. I am thankful to one of the participants who already made these questions, the sanitation workers, their health and safety, whether their work is rewarded or valued, because it's a chain of work. Look, from containment to safe disposal, there are a number of peoples, a group of peoples, where some peoples are working on the sitting on the chair in the office, right, in the Poroshava level or municipality level. Some people are working at the field to get the fecal sludge from our septic tanks. I mean, the versatile, different level of people are engaged there. So what I really, emphasize here, let them understand to have their own jobs there, because we are connecting the, each and every value component of the sanitation value chain. Poroshava people, sanitation worker, plant operator, and everyone, including the mason. So that let them have their own skill, let them educate, and probably we'll get better results. It's not the magic, we'll not get in a day, but within 1 or 2 years of practice, the situation will be improved. That's what I believe. The technology is not only one factor, but of course an important factor. Over to you.
Absolutely, sir. So in the interest of time, there were some more questions. I'll just try to squeeze in and sort of summarize, saying that in terms of technology, yes, we do agree that since it is rural areas, we are more focused on easy to operate, easy to maintain kind of technologies. Of course, there's a lot of research going on, which may be more suitable for the urban areas. But that need not just totally discount the rural areas, because there may be some peri-urban or peri-urban areas which have a land constraint, so they would want to go for more mechanized ways of treatment than the nature-based treatments. And maybe they can afford to have the utilities, the electricity, and even human resources to manage. So on the part of technology, I just want to bring in one very essential question which has come in earlier, saying that we are speaking of first is the containment and second is the treatment. But there's a very important link in between, which is the transportation. And in many of our rural areas, we see narrow lanes, we see access issues with hilly terrains. So are there any inputs, any good examples where people can pitch in? There are just 1 or 2 examples we've seen in India. So yeah, I just open it out to any of the panelists.
Yeah, I mean, when you have the narrow land, the solutions are very much, available, my friend, everywhere. It's not new one. So, there are small sludge pumps which we already customized and connected with the vacuum trucks until the point when the vacuum truck can reach there. And from there, 200 feet of, length of pipe can be connected in the narrow lane and with a small sludge pump that is, that can be put in the septic tank and bring the sludge into the septic tank. The point is whether we want to connect that point or not, number one, because I found that sometimes city authority don't want to go there. This is number one. So we need to motivate them. That is cannot be untouched. Number two, the affordability of that narrow land people. We need to consider that, whether they are getting their value for money or not. I mean, we cannot, because they are living in the narrow lane, if they are poor, if they must get, must not be paid as equal as the rich people. So that can be considered also while we justify the price for the collection system. I mean, these factors are imminent, but the technology is readily available at the market. Over to you.
Thank you. Yes, I totally agree. So even our partners in Leh have tried this sewage cutter pump. Plus, there have been a few examples where people are trying to get small robotic machines which can help in, going to narrow lanes and liquidifying the sludge, which can then be extracted to another vehicle. We've tried the gulper, which is being used in Africa, in and around our in Bangalore itself. There are challenges, but I'm sure as we agreed that as technologies, even this technology of emptying is undergoing some changes. It's undergoing innovations, and these are the forums where we would like people to bring those examples and share for the benefit of all the other viewers. So I just want to end with one last question to Mr. Mohanty, saying that given all these kind of discussions, is the focus in Odisha on linking to the existing urban FSTPs or STPs, or are there even some dedicated FSTPs being planned for rural Odisha?
No, for the timing, the decision of the government is to now extend the urban facilities only to the nearest GPs. But so for the greenfield, as I was just pointing out earlier, that this kind of things is yet to come up, because the entire focus is now to extend this urban facility to the nearest GP areas. So for the greenfield, yes, that will be taken up later on, but not now. For the timing, it's not being focused on idea.
That's great to hear. So yeah, there are a lot of questions coming on sustainability and affordability. So I think this is the right time, Sushmita, for you to pitch in with the financial related questions.
Yeah. So as we were discussing the vehicles, narrow lanes, gulper, and everything, just a quick understanding, because we, as I told you, that we have been actually traveling to different states. So wherever we have seen the urban-rural convergence, the vehicles are there under the SHGs, which are the existing vehicles, and they are being used. But as I told you, there are 5 operational FSTPs which are dedicated to only Gram Panchayats. So they are facing problem for actually purchasing these vehicles. So my question to any one of the panelists, like what is the finance for this buying the vehicles for these FSTPs which are like only dedicated to the Gram Panchayats? Anyone who wants to pitch in, actually.
Yeah, Sushmita ma'am, I mean, I have a point to make here, which is like, I mean, when we look at the budgets of these Gram Panchayats at the block level, right, we are talking about a really small own revenue size. So they don't really have the 2 things. Decision making capability is also one part, but so the oversight, no, the strategic oversight is only for that small region. They can only decide. Plus the money is not there. So it has to be a district level, or it should be a district level function. So the district collector would have to make these decisions. So I cannot speak on their behalf on how they will do the mandate, but it is a district level function in the rural setting, in my understanding. So for assigning the trucks and the assets, that's what I would say in short.
So Sandhya, can you just also just add to this? Like,
yes, that's a challenge we've been facing to operationalize some of our FSTPs, and it's coming from the background that there are no scheme funds available for it. But what we realized that in such cases there is a vibrant private sector which may be informal. It's only a matter of formalizing them, licensing them, training them to extend services. And in some places, we've tried to also break down the cost, saying that if you have a tractor already available for your solid waste collection, large scale solid waste collection, you just need to get a tanker with a pump and use the same tractor. So we are trying to do as per the particular Gram Panchayat's scenario, talking to the Taluk Panchayat or the next level at the Zilla Panchayat, and seeing how we can address these issues. There may not be a straight cut answer for all the Gram Panchayats, but yeah, I think when we get down to a grassroots level, we can find out some simple solutions there.
okay.
So, yeah.
So, Mr. Mohanty, I just means continuing with what Sandhya has said, like as we are talking about the urban-rural convergence, the solid example which you have said in Orissa. So, I just wanted to know, like, how do you actually fix the best fare for the, for the vehicles which are running for the rural areas, because they are under SHG, as we understand when we actually went there.
Yeah, I think currently what the price fixation of the price is done as per the framework or the guideline issued by the state government. But then, so my opinion is concerned, the price should be fixed, taking into different parameters into consideration at least at the ULB level, and that should be the basis, because that's why the government is saying that whatever price is being currently taken by the urban local body, that should be, I mean, particularly in urban areas, that should be taken as a kind of base price, and based on that, whatever distance the vehicle will be covered, so far the cluster is concerned, because the cluster is currently, the state government is guideline is issued for covering 20 kilometers radius from the urban local body's boundary. So in that sense, we have made a three kind of distance band: 0 to 10, 10 to 15, and 15 to 20 kilometer radius. Within that, they are saying that and they are saying that we have used two vehicles, two different capacities of vehicle. One is 1,000 liter, because as earlier was discussed, happened that why we ask for 1,000 liter vehicle, because it's small vehicles. It can go into deeper, I mean, any look and corner of the villages, depending upon the narrow villages, or depending upon the pit latrines kind of things, because knowing the very fact that the maximum number of pits is available in rural areas, or maximum people are having access to pit toilets. So keeping that view, we feel that this 1 KL vehicle will be appropriate to send that vehicle for collection. But the thing is that 1 KL vehicle, they are saying that if they go for 10 kilometer radius from the municipal boundary, they'll consume kind of a 2 liters oil. So and they have kept 90 rupees as kind of benchmark per liter of the oil. So if 3 liters on 10 kilometers they're going, and 2 liter oil they're consuming, then that means 90 into 2 or whatever is being coming out, that is added to the base price, whatever the urban local body is now currently collecting from the urban people. So that becomes the price fee structure for the people, those are, I mean, coming under this 0 to 10 band distance. And similarly, to go for 10 to 15, they are increasing it to 5 liters oil that will be consumed by the particular vehicle, and accordingly 5 into 90 and plus the base price, whatever it would be, that would be the price for the people those are settled within the 10 to 15 kilometers. And similar approach is also followed for the people those are located in from 15 to 20 kilometers. So that is the way the price structure is being now fixed for the people, particularly the rural people, to access these services in the urban services.
Thank you, Mr. Mohanty. But with this, I just move on to the Bangladesh Pৌরসভাs, where Dr. Almuid, how can you make FSM a cost-effective mode of service delivery in rural areas? Any ideas on that? How to make it cost-effective?
Cost-effective, I mean, this word, I think we need to say it after a few years. That's my understanding, my ideology. So my ideology is to bring the service to the people first. So the point is that in the Pৌরসভা, we are still, at the, not in a definite solution that whether we need demand-based emptying or schedule-based emptying, which one is just suitable. Again, it is context specific. That means, if it is schedule-based, then it will be more sustainable because the city authority will, get some revenue after 6 months to collect that, fecal sludge or not. It will, help a lot of issues otherwise also to solve, because the open drain connection that can be removed easily. There is a lot of, pros and cons also. But the point is, again, comes to the affordability and the behavior change. Because in many of the countries, because so far, we didn't have any treatment plant in the cities in mostly. So far in Bangladesh, now 12 to 15 around small or medium or citywide, treatment plants are there. But within 2 to 3 years, it will be more than 150 because the government is scaling it up very rapidly. So in this point of transition, the city authority or Poroshobha will get the sludge only if they are willing to give the sludge to them. I mean, by paying the service. So far, what they're doing, their habit or the behavior is either by manual emptying to, empty it and to dump somewhere, or connect it with the open drain so that they will never face the problem. They don't know even that they have to pay the charge. So these are just, soft issues I think we are now facing, and it has to be dealt delicately. We have few examples, as I mentioned, Lakhipur, Shakipur, Sayedpur, or even Faridpur. We are taking the lessons and making the business plan, as well as, we have to let the mayors of that Poroshobha understand that we need to stop those illegal connections. We cannot, make the direct connection from the septic tank to the open drain. So these are the things we need to set first before proceeding to the setting of the whole free structure. But I can give you one example that in Bangladesh, there are so many cases. I mean, volume-based discharging rate, or even the one-time collection fee rate. But it is whatever the easier to understand by the Poroshobha people, because they are collecting the fee from the people. If it is a smaller, medium, or size Poroshobha, which is around 35,000 population, or even it's a densely populated country, not so big. I mean, 20 square meter or even 30 to 40 square meter. So I mean, then it is better to have the fixed rate. That means if you empty your septic tank or pit, you have to pay this amount, and the amount is around $8 to $10 around, which is 800 taka currency in Bangladesh. So this is something like I give you some idea about the rate, but in the whole country, across the country, the practice of collecting the fecal sludge, this 800 taka is for 1,000 liters, something like that, because the area is not big, the septic tank is not big, and they can move around the city 4 to 5 times in a day. So this is not the problem. But if it is a bigger, city, it is difficult to have this fixed rate. So we have both example, but the rate is around $10 to $15 per 1,000 liter of fecal sludge collection. This is something as a rough estimation. Over to you, Shushmita.
Okay, so looking at the time, Sandhya, I think you should again, start the session, which is very important, legalizing the whole thing and monitoring of the whole system. So over to you, Sandhya.
Absolutely. So I'll start with Avinash. You first saying that we are looking at many informal service providers today, cropping up across different states and districts. So what would your suggestions be to make them to ensure a thriving market for these people? Any key pointers that you can help the listeners with?
Yeah, so there's this idea that has been discussed in my circles over the last 7-8 months about, so the truck operators are already existing there and have their informal existence with the beneficiary groups and everything, right? And then there is this program that comes out of the blue and then tries to kind of get them on board and be part of the systemic regime. Now, there are 2-3 scenarios which emerge here. One is, do you continue the truck operators to get empaneled into your system? Second, if there are Safai Karamcharis or in-house, who getting a salary, how do you make them part of this private regime or collaborate with this private regime? Because if they collaborate also, maybe the private regime will give a better service than them. And then there's this third scenario, which is, wherever manual scavenging is happening, how do you make sure that that's completely cancelled out? One thing that is being discussed, and this is in a nascent stage, so I would not put this out with a full show of authority, but the point is, I believe that wherever the business goes well, it is because there is more ownership among these 4 or 5 stakeholders who work together. Who are the 4 or 5? The people who do collection and conveyance, and the municipal officers, the whatever sanitary inspectors or the government itself, and the plant operator. Now these 3 have to work together. So one idea could also be to increase, because right now when you see in terms of training and capacity building, what's the point of going and giving training and capacity building to a truck operator who's been doing it for 20 years? So if you're doing capacity building, you should probably build skills related to maintenance at the plant, drying, not the big rocket science part of fecal cells treatment, but the very simple parts. If you teach them that and you tell them that there is this additional incentive to drying the sludge and taking it to the market, and when you take it to the market, that portion of the incentive you can keep it. When you give that kind of a training and capacity building, I feel more ownership will come amongst the operators to bring the sludge also to the plant. I feel right now they are looked at as an underground economy who need to be kind of leashed with the system, which is a problem. So they have to, that ownership has to be, and I kind of will draw a feather out of Dr. Abdullah's hat, that because my own experience in Bangladesh, I felt was that this much more program money put into building community ownership, that is much lesser in the context. In most of the projects that I'm working in, I notice that is less here. So the project stakeholders still don't know whether they own this. This journey is not theirs. The journey still belongs to the program designers who are not belonging to the city. I don't belong to Chittoor, right? I don't belong to Madhya Pradesh. I don't belong. So that ownership, and just one final point there is, when you bring so there is one model where the truck operation is completely independent and the plant operation is completely independent, and then you monitor both. There is one where the truck and the plant operation is by one group, so that they have a clear incentive to take the sludge to this thing. And the other is, so basically these arrangements are all centered around the principle of service should not be compromised, sludge has to be collected and conveyed. Then you should cushion viability gap funding in case there is some problem in the middle of the project. There should be, so the arrangement should be done. Then there should be incentives and cost recovery, not in the short run. Like sir said, this is something after 3-4 years of really putting the systems in place, then you can talk about incentives and cost recovery. Right now it would be blasphemy to even mention that. And last, not last but not the least, is creating institutional separation but not allowing monopolies to exist. So this way, if you can, these are principles. I'm not even telling this as this has worked. You will find these have worked in different cases around the country. So from the case studies which CSE, EVAG and all have worked on, when you see them separate in isolation, you'll start finding these learnings. But yeah, these are the principles around which I think.
Great. That's actually a very important input coming here, saying that we are not speaking only of infrastructure creation, but running the whole show. And for this, you need to have even the informal sector folded in, and that could be either capacity building and training, awareness creation, upskilling them, giving them the kind of benefits any formal service provider could get. These are all important. I would also like to go a little bit more deeper into the Bangladesh experience, since you right now spoke more on the financial and other aspects, saying that how is the role divided there in terms of the Panchayat Raj Institute, the Gram Sabha, or the Paurishava, the Gram Sabha, who plays what role, and how is the private sector looped into this whole initiative?
Yeah, thank you, Shandaji. I mean, there is always a card side, of the blessing. That means the coin has two sides always. So let me tell you the one side first. I will tell the other side later. The one side of the coin is the poor, according to our Local Government Act 2009 and all the institutional regulatory framework, as I referred, the policy regimes. The Purushabhas are responsible for providing the sanitation service to the people. So this is very much clear. Who is responsible? The Purushabha people. I mean, Purushabha itself. So but the point comes here. Does Purushabha has the capacity of that issue? I mean, to provide the service of the whole sanitation of the city? Probably no. How to increase that? That's a long journey. I'm telling you the whole story. And the point is, when the government organizations, because the Purushabha, if they have the capacity, they can build their own FSTP, but they don't have. So the Department of Public Health Engineering, they are constructing the the FSTPs for the Purushabha, and they now, in order to get acquainted with the whole ONM, they are providing the service for the 2 years after the project period. So I agree with Avinash in some aspect that yes, we are the ONM issue still is not acknowledging as their own responsibility by the Purushabha themselves. But the reason, I can say another example, the other side of the coin. Some of the Purushabhas are providing service since 2015. I mean, I can give example where I was deeply involved, the Shakipur, the Sayyidpur, because that was the root of the FSM while I started my journey in Bangladesh. So for the last 7 years, they are providing the service. Now the point is, back of the Purushabha, the other institutions are providing some sort of technical assistance as well as some financial assistance without naming the organizations. But it is justified if Purushabha can identify the need, what they really need for doing the ONM. It's not a big deal of money. It's something like that, let's say $2,000 per month. That means in a year it's $24,000. So it's not a big deal of money, but do they need to earn it? Yes, of course, they have to earn it by providing the service. How much they are earning? About 70% they are earning now. 30% is still they are deficit. But they need to know that this 30% they can recover if they write a small proposal to the the local government ministry that we are providing this service and we need this amount of money for the safety of the public health. Do they have the capacity for that? Unfortunately, no. For the last 7 years, this is my failure also, that from the Purushabha, I could not, do this successful advocacy to tap the resource from the, the line ministry, the national government. So this is the art. This is also need the technical capacity, a little bit of writing capacity. But if Purushabha people will learn that, they will come forward in the ONM business and will show their own responsibility as service provider. This is the only gateway, as per my understanding at this moment. Over to you, Shushmita.
Okay, Sandhya.
Or Shondhaji.
Yeah.
No problem. We can, I think, get to the next session.
Yeah, we can. Yeah. So we'll just one more very important question, without which we cannot actually wind up this session is, and I'm going to pose this question to Mr. Ajit Saxena. I hope he's there. Okay. So how can manual scavenging be prevented in any form while engaging the sanitation workers? So, Mr. Saxena, if you can just give your valuable comments on that.
See, it's a challenge. If we do not provide enough capacity building to the people who are doing this amputing business and associating the labor who is doing this manual scavenging available in the village to these operators. Second, still there are not enough amputing operators available in the villages, and because of that people goes for manual scavenging. That means we have to enhance our capacity. Then if we find out some of the people, try to provide them as much as awareness and if effect of the manual scavenging in the village if they do. So alternate employment, alternate possibility of engaging in the same sector but with the motorized or mechanized things is only the way. Third is strict law, which is already there, but enactment is not there. So these 3 points I feel is very important.
Very well received, Mr. Saxena. So with this, we hand over the session to Ms. Natasha Patel. Madam, you can just take over.
Thank you. This has been an absolutely amazing session, I have to say. And more from a personal perspective, we at ISC have been doing a lot of work specifically with regard to treatment. And the way I look at treatment is really, in 4 buckets. So starting with containment, transportation, treatment, and of course, reuse. ISC, as you most probably know, is a platform that facilitates the dialogue between the government as well as the private sector. And when I talk about private sector here, I'm specifically referring to the corporates and other investors who are keen to now participate in creating the right structures for the country as part of the SPM2 plan. So both from Mahua as well as the DDWS, this demand has become increasingly insistent. And that is one of the areas in which the ISC is focused. To give you an example, we have, at the end of last year, we actually concluded a dialogue with the DDWS ministry to look at 100 districts in phase 1 across India, rural India, where we would create lighthouses in blocks that would be pre-chosen and which would be under PPP partnership with the Gram Panchayats there. And so a lot of the points that were raised today were very, very interesting in terms of the kind of solutions that we will now be looking to put in place in these model or integrated villages, as we are calling them. Mr. Mohanty, you referred to the rural-urban convergence. And I think I do agree that that is the only way to go forward. However, the point raised by Arvind, which is around, some villages having their own compost sheds, this is going to be a reality with us for some time because, the geographical distances in some of these villages is huge. And so when you turn it into an economic cost, that becomes a challenge. So until we can find a better solution, we may have to live with these compost sheds. So I think that is something that was quite interesting and quite an eye-opener for me. Sandhya, you mentioned the solid waste management models already being put in place, and hence, FSM solutions being given to those individuals who are managing these. And I'll give you an example in a while about how this can be done through the private sector. And then again, Mr. Monti, you referred to the integrated treatment facilities, which are basically lower in operational costs and larger, because they have larger volumes. And again, I do agree with you on that. So just to put all this into perspective, what is it that the project that I was just referring to aims to do? it aims to actually work in public-private partnerships with corporates that are already doing this work on the ground. So you will be surprised. I'm not sure. I'm sure those who are in the field will not be surprised. But for some of you who may not have seen it, you will be surprised to know that there are corporates that have been actually working on integrated village models for the last 20, 25 years. And they've been doing it entirely off their own cost. But there is the issue of scalability. And this is what the government has recognized. If we have to scale some of these models and take them to other villages and make them equally efficient in terms of lighthouses, then we have to be able to come together between the government and the private sector. And hence this model will look at the future in the following way. So yes, I like the word technical IEC. I think it's an excellent terminology, and hopefully we will be able to use this going forward, specifically with regard to retrofitting, because this is a huge challenge. They don't want to retrofit. They believe it's a waste of cost. How do we actually go about making them understand the necessity of that from a sustainability perspective? Involvement of the private sector definitely will look at rural-urban convergence, because hopefully the need to have individual compost pits in villages will go down dramatically over the years, and having centralized FSTPs, in areas where we can actually club villages together with the corporates coming in, to fund structure around the transportation piece, that is clearly an area that they are looking at. Alternative treatment for reuse for remote sites. I think, again, this is very interesting. Currently today in the rural context for solid waste management, it is all around nature-based solutions. That is not going to suffice. We have to look at chemical treatment, and that can only be done if we do it at a centralized, in a centralized way. So integrated treatment facilities are definitely the way to go. I like the concept of customized technology, but customized technology is not sustainable. We have to look at something which is going to, over a period of time, be sustainable. How do we go about doing that? Skills development, absolutely. I think India has shown the way to the world, where we have even developed the Rani Mason concept. That is something which is so gratifying when we talk about it in an international forum. That becomes something which makes us stand out. So I absolutely think that our concepts around SHGs, Rani Masons, these are truly unique things that we can take to international forums. And finally, the education. This is where, again, the private sector is of huge help. Working with the village communities, I've seen organizations who over the last 25 years have just sat with Gram Panchayats, worked with them to develop their skills, to make them understand what is available to them through the various government schemes, and helping them to develop their own skills so that eventually they can actually take over, because the ground reality is that communities have to be able to manage this themselves in the long term. So I think that is, again, something, that private sector can actually work with the government on. So bringing the service to the people is a today concept. Making it cost effective in the future is the future concept, as far as I can see. So retrofitting, transportation, simple technologies, advocacy with the GP, these are the 4 big areas where we see the private sector actually participating in a very large way. And this project hopefully should go live by the month of May. We are already, starting to work with these corporates. The government is starting to engage with them in these various districts. And hopefully we can do the next 100 districts very, very quickly. So thank you again. I think everything that you have said has been music to my ears. A lot more for us to be able to put into our various programs. And hopefully we can engage with you in a much deeper dialogue going forward. Thank you very much.
Thank you. I think it's been an excellent discussion. Thank you, everybody, especially our panelists and the 2 facilitators and Natasha. and all the participants who actually stuck with us right till the end, even though the webinar has gone on for another 20 minutes. So we will be incorporating the summary from this webinar into the thematic discussion summary. And hopefully in a week's time, we should be able to share that with you. And we will also work on the decision tree that we've been talking about through this webinar. And hopefully that will find wider use. Thank you, and we'll wind this up here.
Thank you.
Thank you, everyone. Thank you for the time and an interesting discussion.
Thank you.
Thank you. Bye-bye.
Thank you.
Thank you.
Everyone.
Stay safe.
Thank you.
Bye.
Thank you, everyone.